We know from both some prior studies and actually also from some recent work that there is an association between patients getting a more specific diagnosis and patients being prescribed appropriate treatment. So when I say more specific diagnosis, what I mean is that someone's given a diagnosis of migraine, for example, rather than just the symptom of headache. And so if a patient is essentially, of course, we want the patients to get better, right? We want people with migraine to have fewer migraines and less trouble with them. And so the idea is if we can nudge providers into the point where they make a more specific diagnosis and then prescribe appropriate treatment, hopefully then that will essentially help down the line. And so we started this work about 10 years ago. I had a grant actually, a Pfizer grant for learning and change to develop a standardized patient questionnaire. We first did it on paper. We did it then into REDCap, which is essentially more of a database type of software. And we used that for a number of years to refine the survey. And then we built that into our electronic health record. And so now what we have is a system where patients who come into Children's Hospital of Philadelphia for a new patient neurology visit are asked at the end of the neurology questions, is headache the main reason for your visit? If they say yes, then they're given the headache questionnaire. That headache questionnaire is then essentially automatically brought into the record, and the providers can either interact with the questions and specifically like answer them, change the answers, et cetera, in a provider form, or just review the patient answers. And what we demonstrated in this work was that when providers use the form, it actually improves care most. But even when the providers just review the patient answers, just having that additional information helps them make a more specific diagnosis. And then even when we've then controlled for the more specific diagnosis, use of the form still increases the chance that a provider will prescribe an appropriate treatment. One could then argue of maybe it's just people who like to take care of patients with headache, who are very good at making diagnosis, who are using the form. So we essentially did another specific analysis of providers who were frequently using the form. And even in that subset, when they used the form, it made a difference compared to when they didn't. So we've done essentially a number of steps to make sure that this is really what we're finding, and it seems to be helpful. The exciting next step is that it's actually been built into then the foundational system for EpicCare, which is one of the more commonly used electronic health record systems. And so it's actually available broadly to any system that uses Epic. And so essentially that patient headache questionnaire was built. It was specifically adapted so that it has all the appropriate answer choices for both adults as well as kids. So it's no longer pediatric specific, and essentially can be used by anybody who's caring for patients with headache. We're certainly not the first ones to work on this, right? So a number of people have tried to work on this issue in the past. The most clear example is Dr. Lipton and his colleagues had developed something called ID Migraine many years ago. And I have seen other examples where the ID migraine questions, essentially, so it's a 3-item screener for migraine, were incorporated into electronic health record, for example, say for primary care clinicians, to help them make a specific diagnosis of migraine. So things like that, again, can nudge care forward. So similarly, we're in the process now of trying to say, can we take our neurology questionnaire and refine it to develop essentially a shorter list of questions that would be helpful for primary care clinicians? This is whether it's our system or whether it's another system. I think, something where you standardly have people essentially think about what else could this be? And then, is this migraine, right? Because a fairly short list of questions could help get you to that point. And that's probably the most important initial steps in terms of diagnosis.